Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. I have here a husband and wife who both attended together, and they're big fans, and I know they're going to be watching this, so hello. They travelled from Cornwall, so Cornwall is at the southern westmost tip of the UK. It's probably around 4 to 5 hour journey each way, and they were due to come a while back, but they just got busy and they finally attended yesterday. And they primarily attended for the husband. So this is the wife's ear that we're having a look at, and she just wanted to book herself in because she was obviously going to come with her husband who had more significant problems with his ears. But it transpired that this patient's itchiness, they were reporting really severe itchy ear in the right side, this ear here. And by observing the ear, we can see why. They've got this really crusted layer of thick, dead skin right at the floor of the ear canal adjacent to the eardrum, so it's quite medial. And I initially used a fine end suction probe because we're so deep in the ear and they've got a very narrow ear canal. That just wasn't strong enough to remove this. So I then soaked the ear with sodium bicarbonate drops for a few minutes to soften this dead keratin, and I went back in with the full Zollner suction probe, but even that wasn't powerful enough. And I'm left with no option but to use an ear hook, and because the ear is so narrow, I'm just trying to figure out the angle of inserting the ear hook into the ear without touching the side of the ear canal. And I managed to leverage the tip of the ear hook behind the wax plug, really close to the eardrum, and I could prise it away. Now, the itchiness did improve significantly. I have given them some other tips, some regular use of some ear oil spray to help moisturize their ear. Now, the eardrum is intact and it's visible. However, as you can tell, it's very dull. There's no light reflex there, and it is retracted. It's buckled inwards in the attic region and also the posterior superior quadrant. And the posterior superior quadrant is, when we're looking at the left ear, it's the northwest region, and the attic is north. So those two regions of the eardrum are sucked in. The patient does experience difficulties equalising their middle ear pressure when on a flight, and they've recently just come back from a flight, and they also do struggle at times when they go scuba diving. So it was a condition called eustachian tube dysfunction. The eustachian tube, the pressure equalising tube connecting the middle ear to the back of the nose, the nasopharynx, is blocked. It's not opening as it should. Therefore, there's a shortage of air behind the eardrum in the middle ear, and all the remaining air in the middle ear is absorbed by the cells in the middle ear. That then creates a vacuum effect, and the eardrum gets sucked in, gets pulled inwards. They are able to perform the Valsalva, closing their mouth, pinching nose and blowing gently, but it's a short-term relief. There is no catarrh, no fluid behind the eardrum, so secondary to eustachian tube dysfunction and negative middle ear pressure where your eardrum gets pulled inwards, you can also get a buildup of catarrh fluid that can get infected as well, and that's because the eustachian tube is not it's not only the pressure equalizer in the ear, but it's also a drain pipe. It allows any fluid, any mucus that is secreted in the middle ear to drain out of the eustachian tube to the back of the nose to ensure the middle ear is air-filled and not fluid-filled. So this is the husband, and this is the main reason why they came. And as you can see, they've got a really blocked right ear. So it's quite a sticky consistency. They have used hydrogen peroxide drops in the past, so I've just re-instructed them on the use of hydrogen peroxide drops. Although it does break up the wax, it can make it really mushy and even more difficult to suction sometimes. So I've just installed some olive oil earwax spray. The brand that I use, it's called Clear. I should declare my conflict of interest. I've been appointed the healthcare advisor of Clear, but it's a great product. If you are in the UK and you want to purchase the Clear olive oil spray, you can visit our website www.clearwax.co.uk. The link is also in the description if you're watching on YouTube, Instagram or Facebook. And you can visit our public online shop and you can purchase the clear olive oil spray. We've also got some other products that may be beneficial to you. If you are a specialist and you want to buy in bulk and keep in stock and sell to your clients or use in your clinic, do register on our website. So visit our website again, select sign in, register as a professional, as a specialist, and you'll get access to our trade shop where you can buy it for trade prices. So you can see what the olive oil spray did. It helped to bind the wax together. It allowed me to get a better suction grip. It helped to lubricate the ear canal wall so there's less friction as I'm removing the wax. And it also helped to lubricate the inside of the suction tube so that doesn't get blocked. I'm now using the fine end, and the fine end, I use the fine end. So it's like an extension, it's like a narrower suction probe, and we had to actually attach it through friction. So we push it into the tip of the Zollner suction probe. And what the fine end does, it just helps me provide more precision in my movement of it. Because it's got a smaller surface area, I use it for more precision work, more delicate areas in the ears, because they do come in contact with the ear canal or eardrum with the fine end. It's going to be less painful for the patient. And it also helps with dead skin. When you've got dead skin, which the patient did have just a moment ago, the posterior canal wall, the back part of the ear canal, you're less likely to get clarinetting. So clarinetting, and we did experience a little bit of clarinetting with the patient. So I think it was at this point, and so we stopped trying to remove any more skin there, just mopping up some sticky wax. So clarinetting is when the skin violently flaps against the tip of the sucker. It's not only loud for the patient, but it's also loud for myself. So again, just mopping up near the entrance. I'm going to go back in. You can see there's a bit of smeared wax just on the anterior canal wall. I'm just going to hover over that again. Now, if you look at this patient's ear canal, you might have just seen it then. They've got quite, it's almost like a ski slope canal wall. They've got parts of the ear canal that are suddenly inclined and other parts that are declined. So no doubt that's contributing towards this patient's wax buildup. The wax can't migrate naturally as it should. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.